Good morning, and thank you for allowing me to present today. All right. As Steve had stated, I'm going to be presenting on 15 years of data. I am Dr. Jacquelin Seals. I am the current project manager of the Kentucky Violent Death Reporting System, and we've been working on our 15-year reports. So that will hopefully be coming out here soon. Just a little bit of what I'm going to be discussing today. I've been working on this project for quite a few years now, and so I am notorious at this point for slipping into acronyms and shorthand. So I figured I'd throw in a slide so you guys know what I'm talking about if I accidentally slip into something that you don't know. And then I'll be discussing briefly the National Violent Death Reporting System, the Kentucky Violent Death Reporting System, and then we'll get into the meat of the presentation, which is the data. So I'm going to go over all manners. I'm going to hit the suicide information really hard because that's what I have done so far on this 15-year report that I'm working on with an intern. And then we're going to be focusing on homicides followed by suicides, homicides, deaths of undetermined intent, legal intervention, and accidental firearms. So because I'm a data person, I wanted to include the ICD-10 codes for all of our deaths that we cover. We cover suicides, homicides, deaths of undetermined intent, deaths via accidental firearm, legal intervention. We cover data that on the occurrence level, so where the injury occurred versus residence, which is where the decedent lived the majority of the time. And that's the KYVDRS data. If you send us a data request, we will be able to pull some demographic information on the residential information as well. And the big things that I might slip on is NVDRS is the National Violent Death Reporting System, and KYVDRS is the Kentucky Violent Death Reporting System. And then also I will be discussing briefly the RUCA codes, or the Rural Urban Continuum codes, which when I do that, it'll be defined as 1 through 3 is urban or metropolitan, and 4 through 9 is rural. So the National Violent Death Reporting System was created and started collecting data in, I believe, 2003 in order to better understand why violent deaths occurred. This is genuinely a nationwide state-based surveillance system designed to track trends and characteristics of violent deaths with the goal of reducing these deaths. In Kentucky, we were funded in 2004 and started collecting data in 2005, which means that we now have 15 years of data. As of 2019, all 50 states, DC and Puerto Rico, have been funded by the CDC to collect this information. So it truly is a nationwide surveillance system. KYVDRS specifically collects information on homicides, suicides, accidental gun deaths, deaths of undetermined intent, where the injury occurs in Kentucky. Demographic and circumstantial information on these deaths from all investigators, along with weapon and toxicology information. What makes our data very unique is we use source material to confirm manner of death. We collect it from all death scene investigators when it's available. And as I had stated, we do confirm the manner of death. This means that we have an abstractor manner of death. This does not shadow anything else what the death scene investigators do. This is just when we put all of the source documents together, we read all of the materials and we confirm what is most appropriate. We do not put any interpretation into what the source materials say. It must be listed on the source documents, with the exception of legal intervention. We have data available on demographics, circumstantial, weapon, and when applicable, toxicology and suspects. We also have a little bit of a lag in our data availability. It's approximately a 2-year lag, and this lack of timeliness reduces our ability to respond to trends quickly. So like I said, we're going to get into the meat of it now with our data, which is what I can speak to much better. As you can see, our cases were rising until 2016 when we topped out at about 1,200 cases a year. By 2019, thankfully, those numbers had decreased to 1,100. Suicides were up until about 2018, and we saw that lovely drop in suicides in 2019. When we start talking about the manner of death over time by sex, we know that it is predominantly males. This trend of being higher in manners follows in both suicides and homicides, with suicides obviously being the predominant number of our cases. But when we start to talk about suicides, you can kind of see more of a breakdown by age. This is raw numbers. It's not rates or anything at this point. But you can see that the bulk of our suicide decedents are 40 to 59, followed closely by the 25 to 39 age group and the 60 plus. We have seen some recent disturbing trends in our younger age groups. And with those numbers being so small, any rise is disturbing to us, especially that age group, the youngest age group. We also have been seeing our trends changing in our race and ethnicity groups. And I want to point out that on our race and ethnicity table, our percentages start at 90%. So our cases are still predominantly white individuals, but you see as time goes on, especially in 2019, that our breakdown is getting more diverse, with an increase in Black and African-American non-Hispanic populations. And this trend follows with national trends, unfortunately. When we start talking about the method of death over time, as we all know, it is firearms. That is the sad thing of the truth of it. But we have been seeing a rise in hangings, and we kind of think of this as any means available. But when we do know the weapon information, when it comes to the firearms, we know that it is predominantly handguns, usually of an unknown type or a revolver. And if we know the shooter or the owner information, the owner of the weapon is usually the shooter or a family member / parent. And as I stated, we do collect circumstantial information. As you can see in this first table right here with the suicide, self-harm, threats, and ideation or notes, our number of deaths have increased, and our percentage of cases with known circumstances is averaging at this point about 86%. As you can see, consistently over time, we range about 20% have left a suicide note. Disclosed intent to another is about 16%. And our history of suicidal thoughts and plans, we don't necessarily have the ability to track this one over time because it was not added until 2013. So our last year, about 22% of the last 5 years is where we're at. When we start talking about the history of suicide attempts prior, we're at about 12%. But I think the most interesting trends as how they've changed over time is those with a defined depressed mood. So the source document stating that the person was depressed, feeling down, feeling blue, something along those lines, that has decreased while substance use and arguments have increased over time. And when we start to look at the toxicology of our suicide decedents, when I did this, I used positive drug results. So we're looking at amphetamines antidepressants, anticonvulsants, antipsychotics, barbiturates, benzodiazepines, cocaine, marijuana, muscle relaxants, and opiates. And our data does not always get tested. And since this is self-reported, so to speak, where we get the information from coroners, they may not have had they may have sent the test in, and by the time they get the results back, and to us, we don't have somehow we don't have the toxicology results. And that's fairly common for this data. And usually, like I said, it wasn't tested in this population. When we start to talk about our homicides followed by suicides, as you can kind of see, our trends follow over time. Our homicide victims probably are a little bit higher for the most part because there were multiple victims. When we start looking at decedents, female decedents were predominantly homicide victims, and over 2/3 of our male decedents were suicide decedents. By age, so most, about 95% of the suicide decedents were 25 or older, and 70% of our homicide decedents were between the age of 25 to 59. 10% were younger than 17. The majority of our decedents were white, with about 33% of our suicide decedents having never finished high school, and 45% of our suicide decedents have a high school degree or equivalent. And over 50% of these incidents occurred in a more rural county. When we start looking at our homicides compared to, we have our age group, obviously, but when we start looking at the race, compared to the national trends of Kentucky homicides are predominantly white, and this is reflective of our national trends. And our younger age group is starting to increase some. When we start talking about the methods, we do know that our firearms, and as I can state again, predominantly when we do know the weapon, it is firearm. As you can see, my axis does not start at 0. And it's usually a handgun, either of an unknown type or semi-automatic. And if we do know the owner, which is not as frequently as we would like, we do know that it is the shooter. And then when we start looking at our victim to suspect information, we do have a lot of the relationships are considered unknown. But when we do know that it was a intimate partner, over 80% known, it's a known current intimate partner. So either spouse or girlfriend, boyfriend. When it's family, we're talking predominantly the child or the parents of the victim, followed by other family type. So not a sibling. And then when we start talking about our deaths of undetermined intent, it's predominantly white, have a high school degree or lower, live in an urban area, and poisonings account for about 60% of these deaths. About 8% are both firearms and unknown. And that is both 8% firearm and 8% unknown, not combined. And as you can see, this is also, like I said, predominantly in this 40 to 59 age group. When we start talking about legal intervention, our numbers are really small, so I don't have as much data or information on these posted, but it is predominantly male, 25 to 59, white, have a high school degree or lower. And of those who were tested, about 60% of the victims had a positive toxicology result for drugs or alcohol. Conversely, when we start talking about our accidental firearm discharge, it's predominantly male, 45 or 40 or older, closely followed by the 25 and under age categories. Whites have a high school degree, and I think it's very unique in this group where drugs or alcohol were present in about 40% of decedents. So this is actually lower than all of our other manners combined, the average, I should say. And then when we start talking about the type of weapon used in these accidental firearm discharge, we are talking predominantly handguns. And when we do know the owner, it is usually the shooter. And I did kind of blare through that. So if there's any questions, please let me know.
Thank you, Jacqueline, or Dr. Seals. I had a question for you, and if anyone has questions, feel free to put those in the chat box or raise your hand and we can unmute you. It was on the relationship status to the suspect. I noticed that there was quite a few that we didn't know for the homicides, what that relationship status was. Are there any supplemental data sources to pull additional information on that variable?
So in a lot of those, it's most likely they're still an open case. So they either don't know the suspect, or because it is open, it is not provided to us at a risk of, it's just a policy to not share open data. So we do pull whatever we can. We do have an agreement to get law enforcement data of it whenever it's available. And we do occasionally pull court records as well.
Have you all ever used any social media to inform any of that? Since it is
we are required by our funding agency to use like more legal documents. So we will occasionally use media sources, but not social media.
Okay. Thank you. Also, Marcy is asking, she noted that gender information is only available for male and female. Is there any way we are able to identify trans or non-binary persons? Is that something we need to advocate for more tracking more clearly?
So we do have the ability to identify that, but if it is not listed in our source document, so if it's not listed on the death certificate or the coroner's medical examiner or law enforcement documents, we don't know. I think that is something that we definitely need more information on. We would love more information, and we've had internal conversations about that, but we honestly don't have that information. It's not being provided to us. So if you on your own want to advocate for it, we as a team would love that.
And similarly, we have the question in regards to multi-race. We noticed that it was Black, white, non-Hispanic, or just Hispanic. Was there anything or any variables you collect on multi-race? Is that a variable?
We do collect information on multi-race. The numbers are just so small that we kind of have to combine them, because following state data release policies, we can't release numbers less than 5. And at that point we are. But we do have the ability to select as many races as is listed on our documents. So we do know that we do have decedents who are multi-race, and we do collect that information.
Very interesting. It would be neat to see that information if it didn't have to be aggregated for small numbers. We also have another question from Diana Leathers. Is there any data tracked for adverse childhood experiences related to those committing homicide?
Unfortunately, unless it is also it's a homicide suicide, we do not have any circumstantial information on the suspects of a homicide. We know their relationship to the decedent. We know if they've ever been in jail. We know like if it's provided, we are allowed to enter in like criminal history to a degree. I believe there is a question on if they've been abused, but that is never provided to us, I would say. So unfortunately, we don't have documents that give us information on the ACEs related to the suspects. I really wish that we did.
Thank you. We also have Dick Bartley says, as the state trauma coordinator, it seems like a lot of this is very similar to the Kentucky Trauma Registry, data assembled by Kiprick and Dr. Costin. Is your report and data coordinated with the recently released 2020 Kentucky Trauma Registry report?
It has not been.
Okay, and then we have another question. On the accidental firearm discharges graph, I believe it was on the right side of the page, we have a group that focuses on child home safety. And part of that home safety is unintentional firearm injuries as well as overdoses. Do you have any, can you share with us any percentages or information related to children or those, what you're seeing for children less than 5 years of age?
I do not have that data on me at the moment, but if you want to send in a request for that information at kvdrs@uky.edu, I am more than happy to pull that information.
Thank you. And we're going to give a pause just in case there's a few other questions for Dr. Seals. And if there are not, we will wrap up.
Well, while we're waiting, Jacqueline, thank you for an excellent presentation. Thank you for
having me.